So being healthy means different things to different people. But what I can tell you is that health is no longer just an absence of disease. The truth is that many of you are not healthy. This is simply because we live in a toxic world today. While the technological advancements and scientific breakthroughs allow us comfort, we also have so many more symptoms and diseases due to the sedentary lifestyle and stress we are prone to today. Knowing this, what does being healthy feel like? Health is not an absence of disease, okay? So let's talk about your physical health. Being physically healthy should include the ability to transfer from a seated on the floor to standing using only your legs, not having to go sideways with your hands and getting yourself up. Healthy should include going through the day full of vigor and energy. It should include the ability to walk a mile without any problems. And being physically healthy should include waking up or waking up in the morning refreshed and revived after a full night's sleep. Healthy should include having no aches and pains. It should include your ability to activate any muscles in your body at will. Healthy should include having a bowel movement every single day and nice form bowel without strain. Also, healthy should include the ability to have self-mastery over any circumstances in your life. Finally, being physically healthy should include the ability to stand on one foot without shoes for at least 30 seconds. Okay, second, let's talk about emotional health. Being emotionally healthy should include your ability to feel emotions, both good and bad. It should include your ability to love and to receive love. Healthy should include self-love. It should include taking full responsibility for the results in your life and health. Emotionally healthy should include your ability to own your mistakes and blame no one. Finally, it should include your ability to set clear boundaries with those you love. So let's talk about mental health. Being mentally healthy should include your ability to honor yourself by keeping your promises to yourself. It should include your ability to grow and evolve. It should also include your ability to be proactive versus reactive to your life. Mental health should include planning ahead. It should include your ability to commit to your goals until you achieve them, no matter what. Healthy should include your ability to understand that failure is a requirement for achieving lofty goals. It should include your understanding that your thoughts are optional, but your thoughts create the results in your life. Finally, being mentally healthy should include knowing how to think for yourself. So let's talk a little bit about what we measure health, right? We measure health with biological markers of health at the physician's office. Truth is that for most of us, getting a physical and necessary labs done at the doctor and checking that off also means being healthy. But many of you have hypothyroidism, high blood pressure, high blood sugar levels, depression, anxiety, high cholesterol, and struggle with some type of pain, and you think that's the norm. You take multiple medications but report being healthy. The medications make the cholesterol, blood sugar, and thyroid numbers appear within normal range. That's not healthy. Healthy is when your system's thermostat is set and you don't need medicinal intervention to have the numbers right. Just because your cholesterol values are normal with Lipitor does not make you healthy. In fact, many of my diabetic patients report being super healthy and eat junk like McDonald's because their glucose levels are within normal limits with glucophage and insulin shots. That's not healthy. Beyond the regular lipid panel, metabolic panel, and the CBC, there are many other tests to check in detail to see if you fall under the healthy category. Because as I said, health is not simply just the absence of disease. Lab values may be normal for years, but you can have symptoms that puzzle the medical community. Symptoms should be treated, but not nurtured. Most of us believe that despite the symptoms, because our labs are normal, we're healthy. Today, it has become the normal to feel suboptimal every day. More frequently, I'm getting patients who know there's something wrong, but the doctors keep insisting that all labs are normal. Remember, when it comes to health, an ounce of prevention is far better than pounds of disease. Have you been struggling with symptoms that don't seem to go away? Come to one of our free Q&A info sessions led by me to learn what you can do to start feeling better. We do these sessions every other Wednesday at 5 p.m. The next session is January 29th at 5 p.m. I hope to see you there so you can ask away, because we've got plans, we've got support, we've got programs, and definitely you can reverse anything, especially if it's not to the level of disease. So don't wait for the disease to happen. Don't think just because you're absence of disease that you're healthy. Medications is not the long-term solution. Thank you so much for watching. Please subscribe to our newsletter on alkalinewellness.com and our YouTube channel, Dr. Connie Jian. And also follow us on Facebook, Instagram, and Pinterest at Alkaline Wellness for all the new updates and to follow us and see what we're up to. See you guys soon.